Mag Delay is a mineral supplement used to prevent and treat low amounts of magnesium in the blood. It can also be used to treat symptoms of too much stomach acid, such as stomach upset, heartburn, and acid indigestion. Magnesium is essential for the normal functioning of cells, nerves, muscles, bones, and the heart. While a well-balanced diet usually provides enough magnesium, certain situations can cause your body to lose magnesium faster than you can replace it from your diet. These situations include treatment with water pills, diuretics such as furosemide, hydrochlorothiazide, a poor diet, alcoholism, or other medical conditions, such as severe diarrhea/vomiting, stomach/intestinal absorption problems, poorly controlled diabetes. It is best to take Mag Delay as directed by your healthcare professional and to follow their recommendations for the best time to take it and the appropriate daily dosage. When taking Mag Delay, it's important to follow the directions on the product package. It's best to take magnesium supplements with a meal to reduce stomach upset and diarrhea, unless told otherwise by your doctor. Remember to take each dose with a full glass of water, unless directed otherwise by your doctor. If you're taking the chewable tablets, be sure to chew thoroughly before swallowing. If you're using a liquid product, use a medication measuring device to carefully measure the dose. Take this medication regularly at the same time each day to get the most benefit from it. The dosage is based on your medical condition and response to treatment, so do not increase your dose or take it more often than directed. Be aware that too much magnesium in the blood can cause serious side effects, so it's important to follow the recommended dosage. If you experience symptoms of low magnesium blood levels, such as muscle cramps, tiredness, irritability, or depression, be sure to tell your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience stomach upset or diarrhea when taking Mag Delay, try taking it with a meal to reduce these effects. If these symptoms persist or worsen, be sure to contact your doctor or pharmacist. Your doctor has determined that the benefit of using Mag Delay outweighs the risk of potential side effects. Many people who use this medication do not experience any serious side effects. Although it is rare, a serious allergic reaction to Mag Delay may occur. Seek immediate medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of potential side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. As for the best time to take Mag Delay, follow your doctor's instructions. They will provide you with the recommended dosage and the optimal timing for taking this medication. Before taking Mag Delay, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions. If you have kidney disease, it's important to consult with your doctor or pharmacist before using Mag Delay. Some forms of Mag Delay may contain sugar, aspartame, or alcohol, so if you have diabetes, alcohol dependence, liver disease, or phenylketonuria, PKU, it's important to use caution and consult with your doctor or pharmacist about using this product safely. If you are pregnant, Mag Delay should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using Mag Delay if you are breastfeeding, as it is unknown if this product passes into breast milk. It is important to be aware of potential drug interactions with Mag Delay, as they may affect how your medications work or increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Some products that may interact with Mag Delay include cellulose sodium phosphate, digoxin, and sodium polystyrene sulfonate. It's important to note that magnesium can bind with certain medications, preventing their full absorption. For example, if you are taking a tetracycline-type medication, it's recommended to separate the time of the dose from the time of the magnesium supplement dose by at least 2 to 3 hours. If you are taking a bisphosphonate, a thyroid medication, or a quinolone-type antibiotic, it is important to consult your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. Additionally, it's important to check the labels on all your prescription and non-prescription/herbal products, such as antacids, laxatives, and vitamins, as they may contain magnesium. Ask your pharmacist about using those products safely. And it is best to take Mag Delay at a different time than these medications. If someone has taken too much Mag Delay and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include slow heartbeat, severe drowsiness, dizziness, confusion, muscle weakness, and loss of consciousness. It's important to have lab and/or medical tests done while taking Mag Delay, such as magnesium blood levels and kidney function tests. Make sure to keep all medical and lab appointments and consult your doctor for more details. Magnesium supplements come in various forms and doses, and many are available without a prescription. It's best to ask your doctor or pharmacist for help in choosing the right product for you. In addition to taking Mag Delay, it's also important to maintain a well-balanced diet. Foods high in magnesium include avocados, bananas, beans, whole grain cereals, green vegetables, and nuts. Remember to include these in your daily meals for the best results. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Remember to store Mag Delay at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. It's important not to flush Mag Delay down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.